Welcome, curious minds, to a journey into one of humanity's most enduring and profound struggles, the battle against unseen enemies, the scourges of disease that have swept through civilizations, altering lives and shaping history. Today, we delve into the inspiring narrative of the unseen healers, a story of extraordinary resilience, scientific ingenuity, and compassionate dedication. This isn't just a tale of illness. It's a testament to the unwavering human spirit that time and again rose to confront devastating epidemics. It celebrates the medical practitioners, the scientists, and the countless ordinary citizens who, in the face of unimaginable terror, pursued knowledge, made groundbreaking discoveries, and tirelessly worked to alleviate suffering. Imagine yourself living in an age where an invisible threat could decimate families and towns overnight, and then consider the courage of those who dared to defy it. This is a story etched in the annals of medicine and compassion, offering timeless lessons in perseverance, scientific inquiry, and the enduring human imperative to care for one another. Imagine a world where the very air you breathed could carry a silent death, where a sudden fever or a swelling in the armpit could signal the beginning of the end. For much of human history, devastating epidemics were not anomalies, but recurring terrors. From the infamous Black Death that swept through medieval Europe in the 14th century, knocking out an estimated one-third of the population, to recurrent waves of plague, cholera, and smallpox in later centuries, communities lived under a constant existential threat. Consider the daily challenges faced by individuals and entire societies. Life was precarious. The sudden onset of illness in a household would ignite instant dread, leading to desperate measures. Families would face agonizing choices: to flee, potentially spreading the disease, or to remain and care for their loved ones, risking their own lives. Picture the fear of contagion, a fear amplified by a profound lack of understanding about how diseases spread. Without the knowledge of germs or viruses, the unseen enemy felt like a malevolent force, striking seemingly at random. Leading to widespread panic, suspicion, and despair, the societal disruption was immense. Cities would empty, trade would cease, and the fabric of daily life would unravel. Funeral rites became impossible to maintain, leading to mass burials. The pressure on rudimentary medical systems was overwhelming. Doctors, often operating with limited knowledge and ineffective treatments, found themselves helpless in the face of widespread sickness. Their tools were crude, their understanding of pathology incomplete, and their own lives constantly at risk. Yet, amidst this terrifying reality, the extraordinary resilience of the human spirit shone through. This was not a passive acceptance of fate, but an active, often desperate, struggle to survive and protect loved ones. Think of the unsung heroes, the family members who stayed to nurse the sick. Despite knowing the immense personal risk, the community leaders who tried to maintain order and provide some semblance of care, the religious figures who offered solace and comfort. Communities, despite their fear, adapted with remarkable ingenuity. When plague struck, cities would implement early forms of quarantine, isolating the sick or closing their gates to outsiders. Though imperfect, these measures were attempts to control the uncontrollable, showing a nascent understanding of containment. Makeshift hospitals would emerge in churches or large public buildings, staffed by courageous individuals who volunteered to tend to the dying. Imagine the sheer determination required to walk into such a place day after day, knowing the dangers, driven only by compassion. There were also ingenious, though often desperate, attempts to find remedies. People tried everything from herbal concoctions to bloodletting, from burning aromatic woods to wearing protective masks filled with sweet-smelling herbs. While many of these practices were ineffective by modern standards, they represent a powerful human drive to act, to seek solutions, and to defy the hopelessness that widespread disease could engender. These were the countless small daily acts of perseverance and compassion. A shared meal for a quarantined family, a gentle hand on a fevered brow, a quiet prayer whispered for the departed that allowed societies to endure and eventually find pathways to recovery, strengthening the communal bonds in the crucible of crisis.
Ow.
This segment highlights how Even when confronted with an invisible enemy that defied understanding and overwhelmed existing systems, the human spirit displayed an unwavering will to survive, adapt, and care. These early struggles, marked by fear, but also by profound acts of courage and communal strength, laid the foundation for a long, arduous, but ultimately triumphant journey in the pursuit of health and well-being. In the vast, terrifying landscape of historical pandemics, where fear and superstition often overshadowed scientific inquiry, there arose a figure whose methodical brilliance would forever alter humanity's understanding of disease. This was Dr. John Snow. He's an English physician whose groundbreaking work during the 1854 cholera outbreak in London stands as a monumental triumph of empirical evidence over entrenched dogma. His story is a powerful testament to the transformative potential of a single mind driven by truth and data. Imagine mid-19th century London, a sprawling, rapidly industrializing metropolis, yet one still grappling with rudimentary sanitation. Cholera, a terrifying and often fatal disease, was a recurring nightmare, striking swiftly and indiscriminately. The prevailing medical theory, the miasma theory, held that diseases like cholera were spread by bad air or noxious fumes emanating from decaying organic matter. This belief, though intuitively appealing, was a significant barrier to effective public health measures. Dr. Snow, however, was a skeptic. He was an astute observer and a meticulous data collector, attributes that would define his extraordinary path. He had long harbored doubts about the miasma theory, noting that cholera seemed to affect the digestive system, suggesting an intake of something rather than an inhalation. His pursuit of knowledge was relentless, driven by a profound desire to alleviate suffering and uncover the truth. The 1854 outbreak in the impoverished Soho district of London provided Snow with a grim opportunity to test his hypothesis. Picture the panic, the rapid succession of deaths, the overwhelmed medical professionals. While others succumbed to fear or accepted the prevailing wisdom, Snow embarked on a pioneering investigation. His strategic brilliance was not in a sudden flash of genius, but in his rigorous, almost detective-like approach. He didn't just treat patients. He meticulously mapped every single cholera case. He walked the streets, interviewed residents, families, and local officials, painstakingly recording every death and its precise location. His maps, with their stark dots representing each cholera fatality, began to tell a story that contradicted the miasma theory. The deaths clustered intensely around a specific public water pump on Broad Street. Further investigation revealed a powerful correlation. Almost all the victims had consumed water from that particular pump. He noted, for example, a nearby brewery whose workers, known to drink beer rather than water, were largely unaffected. He also traced cases to individuals who had the water delivered from the Broad Street pump, even if they lived further away. Snow's findings faced immense skepticism and resistance from the established medical community, whose reputations and careers were often tied to the miasma theory. Imagine the challenge of advocating for a radical new idea against deeply ingrained beliefs and powerful figures. Yet Snow persevered, armed with his irrefutable data. His meticulous collection and powerful visualization of evidence were a form of strategic brilliance, allowing the truth to emerge with compelling clarity. The ultimate triumph of Dr. John Snow's meticulous scientific method came when, armed with his damning evidence, he persuaded local authorities to remove the handle from the Broad Street pump. This simple, decisive action, based purely on epidemiological data, led to an almost immediate and dramatic decline in new cholera cases in the affected area. It was a victory not just for science but for humanity, proving definitively that a clean water supply was paramount to preventing the disease. This segment showcases how a single individual, through unwavering dedication to empirical truth, strategic brilliance in data analysis, and immense personal courage to challenge the status quo, can revolutionize an entire field. John Snow's work marked the dawn of modern epidemiology, transforming public health from an intuitive art into a rigorous science. His legacy is a powerful reminder that observation, logic, and the relentless pursuit of verifiable facts can overcome ignorance and save countless lives, fundamentally altering our approach to global health. The groundbreaking work of John Snow was a crucial turning point, yet it was only the beginning of humanity's profound journey into understanding disease. The true unraveling of the unseen healers, The microscopic pathogens themselves would require monumental intellectual leaps, meticulous experimentation, and the relentless dedication of pioneers who dared to peer into the invisible world. This segment celebrates the astonishing human ingenuity applied to solving the historical challenges of infectious diseases, leading to breakthroughs that would transform public health on a global scale. Imagine a world still grappling with devastating scourges, but with a burgeoning scientific curiosity. One of the earliest and most impactful discoveries came from an English country doctor named Edward Jenner. In the late 18th century, smallpox was a terrifying and highly lethal disease, disfiguring survivors and killing millions. Jenner observed a curious phenomenon. Milkmaids who contracted cowpox, a mild bovine illness, seemed to be immune to smallpox. This observation, combined with a meticulous scientific approach, led him to perform his famous experiment in 1796. He inoculated a young boy with material from a cowpox lesion and later exposed him to smallpox. The boy remained healthy. This audacious act, built on careful observation and a fearless commitment to testing hypotheses, led to the development of the smallpox vaccine, a medical revolution that offered the first truly effective protection against a deadly infectious disease. Jenner's work, though initially met with skepticism, laid the groundwork for the field of immunology. His ingenuity wasn't just in the act of vaccination, but in the systematic approach to understanding disease prevention. This was a monumental step, but the why and how of infection remained a mystery. That mystery began to unravel with the tireless work of figures like Louis Pasteur in the mid-19th century, a French chemist. Pasteur's meticulous experiments shattered the long-held belief in spontaneous generation and conclusively proved the germ theory of disease. Imagine the intellectual rigor required to demonstrate that invisible microbes were responsible for fermentation, spoilage, and crucially human illness. His elegant experiments, such as those with swan-necked flasks, showed that life did not spontaneously arise, but came from pre-existing microbial forms. This breakthrough was nothing short of revolutionary. It provided the scientific foundation that doctors and public health officials desperately needed. Suddenly, the unseen enemy had a name, a form, and a modus operandi. The implications of germ theory were profound. If diseases were caused by microbes, then preventing their spread became a matter of controlling these tiny agents. This understanding spurred a cascade of public health revolutions. Antiseptic surgery. Inspired by Pasteur's work, figures like Joseph Lister pioneered antiseptic techniques in surgery, dramatically reducing postoperative infections and saving countless lives. Imagine the courage to challenge established surgical practices and introduce radical new methods like carbolic acid sterilization. Improved sanitation. The germ theory provided a scientific imperative for clean water, sewage systems, and waste disposal. Public health reformers, now armed with scientific proof, could advocate for massive infrastructure projects that fundamentally changed urban environments, protecting populations from waterborne diseases like cholera, sterilization, and hygiene. Understanding germ transmission led to widespread adoption of hand washing, sterilization of medical instruments, and general improvements in personal and public hygiene, dramatically curbing the spread of infections in hospitals and homes. This segment evokes wonder at the sheer human intellect and dedication required to unravel the fundamental mysteries of disease. From Jenner's daring observation to Pasteur's meticulous experimentation, these were intellectual leaps that redefined medicine. The relentless pursuit of effective treatments and preventative measures, driven by compassion and scientific rigor, had a profound impact. These discoveries transformed public health practices, leading to widespread vaccination campaigns and a dramatic increase in life expectancy, showcasing humanity's extraordinary capacity to understand, innovate, and conquer the invisible threats to its well-being. The monumental scientific and compassionate efforts of the unseen healers, from the observant country doctor to the meticulous laboratory scientist, culminated in a legacy that has profoundly reshaped human existence. This final segment examines the enduring impact of these historical medical triumphs, highlighting how the lessons learned from past pandemics and the foundational discoveries in epidemiology and immunology continue to inform our modern world. leading to the eradication of devastating diseases and the continuous human endeavor to build healthier, more resilient societies. Imagine a world where smallpox, once a terrifying and ubiquitous killer, is no longer a threat. This monumental achievement, the global eradication of smallpox in 1980, stands as one of humanity's greatest public health triumphs. It was the direct culmination of Edward Jenner's pioneering vaccine, refined over centuries, coupled with decades of tireless international collaboration, strategic vaccination campaigns, and unwavering political will. This victory, born from scientific ingenuity and collective action, proves that humanity can, indeed, conquer a widespread disease. It's a powerful testament to what can be achieved when scientific knowledge meets global cooperation. The principles established by John Snow, Pasteur, and their contemporaries form the bedrock of modern public health. Today, our understanding of disease surveillance, contact tracing, sanitation, and hygiene directly stems from their initial breakthroughs. Think of the intricate global networks that monitor emerging infectious diseases, the rapid development of new vaccines for novel pathogens, and the public health campaigns that promote hand-washing or safe food practices. These are all direct descendants of the relentless pursuit of knowledge in the age of plagues. The courage of early public health advocates, who often championed radical ideas against great opposition, laid the groundwork for the robust public health systems that protect billions today. Moreover, the scientific insights gained from battling historical epidemics continue to fuel cutting-edge research in immunology, virology, and microbiology. The very methods used to study and combat diseases like COVID-19 have their roots in the foundations laid by these unseen healers. Their intellectual curiosity ignited a flame that continues to burn brightly in research laboratories worldwide, pushing the boundaries of what we understand about the human body and its microscopic adversaries. This segment underscores the profound societal change brought about by scientific progress and the power of collective action. It reflects on the lasting impact of leaders and everyday citizens who, in their own ways, contributed to this grand narrative of healing. The stories of those who bravely cared for the sick, those who tirelessly sought scientific answers, and those who implemented widespread reforms serve as a timeless reminder of our shared human capacity for empathy, intelligence, and perseverance. Their legacy is a continuous journey towards a healthier future built upon the hard-won lessons of the past. Our journey through the unseen healers has taken us from the terrifying uncertainty of ancient plagues to the profound clarity of modern medical science. We have witnessed the raw resilience of communities facing invisible enemies, the singular brilliance of figures like John Snow, who revolutionized our understanding of disease, and the collective ingenuity that led to life-saving breakthroughs like vaccines and germ theory. From the shadow of sickness, we saw remarkable courage. From the seemingly insurmountable challenges of contagion, we uncovered the power of observation and scientific method. And from it all, we draw a timeless legacy. Not only have we pushed back the tide of devastating diseases, but we've also built healthier, more empathetic societies. The story of the unseen healers is a powerful testament to humanity's unyielding drive to alleviate suffering, to seek knowledge against all odds, and to care for one another when faced with crisis. It teaches us that compassion is as vital as scientific discovery, that perseverance can unlock the deepest mysteries, and that the combined efforts of many can achieve truly world-changing outcomes. As you reflect on the incredible journey of these pioneers and the advancements they ushered in, consider the unseen battles in your own life or in the world around you. How can you apply a spirit of resilient care, a dedication to understanding, and the power of collaboration to overcome challenges? The echoes of their triumphs resonate still, inspiring us to continue the noble pursuit of knowledge, to extend compassion to those in need, and to build a healthier, more resilient future for all. That brings us to the end of another journey through the annals of inspirational history. We hope this story of triumph, resilience, and the enduring human spirit has left you feeling empowered and reflective. If you were moved by this tale, please like this video, subscribe to our channel for more journeys into the past, and comment below with your thoughts or any historical moments that inspire you. Your engagement helps us continue to share these powerful stories of human triumph.